Hi, everybody. It's Jessica DaMassa with WTF Health. What's the future health? We are talking to the who's who of health tech and innovation from around the world. And unbelievably, this pandemic has gone on long enough where we need to check back in with our man in Europe. This is Roberto Ascione, who is the CEO of Healthware Group and also the chairman of Frontiers Health, which is one of my favorite conferences that is going to be digital this year for the first time ever. Usually it's in Berlin. So Roberto, great to have you with us again.
Hi, Jessica. Thanks for having me.
So we spoke to you pretty early on in the pandemic. It was April. And at the time you were giving us an update on what was going on in Italy. You were in the middle of launching a really rapid startup that had a telehealth capability, scaling it up, working with the government. Give us an update on how things are going in Europe, especially from a digital health or a health technology standpoint. As far as the pandemic goes, has uptake for telehealth continued to grow in terms of patient utilization? What's the appetite for involvement with some of the government health organizations and the hospital systems? Give us a state of play. What's been happening in Europe?
Yeah, with pleasure. We've been, as you might remember, I was talking about having done like 10 years in 10 days back then, because Italy, where I was sheltering at the time, which by the way, I'm still sheltering in, was one of the first countries after China to get severely impacted. So because of the lockdown and social distancing first and lockdown after, the country had to come up with new solutions. And that was the case of that telehealth startup that we helped to basically open up, pivot a little bit the model and make the platform accessible for free to doctors and patients. Since then, this has been growing really fast. To date, over 250,000 patients have been treated either through the symptom assessment, triage process, all the way through the video visit features, including for cases where that was needed, the whole monitoring of the symptoms, then more recently also connected to monitoring devices. So it's been, it is being a great experience. Started in our kind of home country, at least where the company was founded many years ago. But then this expanded to other countries, as you know. And so we have been working since then on global new normal and telehealth strategies for a number of different companies, helping them to partner up with startups that meanwhile have been in more and more countries pivoting and or anyway responding in a creative way to this emergency. And since then we went through May when we launched that special Frontiers called Fight the Pandemic, or nicknamed Fight the Pandemic, where we did showcase a number of the solutions that were by that time deployed globally and accruing data. Since the end of May, we went through like the summer months, where while certain stakeholders have been a little bit breathing and then keep preparing for what we knew would come as wave 2, which now we are like in the beginning of it, with literally these days going back to a quasi or full lockdown, depending on the countries. So far, a lot more digital health solutions are in place. And you can see that because we are approaching this wave 2 with a lot more ammunitions that come from the experience that we had done during the phase 1. And also a lot of these activities to kind of strategize about the future new normal are now starting to come to fruition. So in a nutshell, both in the camp of the work we do for the large-scale pharmaceutical medical device companies, when it comes to exactly those strategies and that implementation, we have been very busy on that. And I think a lot of the learnings of the early days are now being deployed in either proof of concept or at-scale solutions. And when it comes on the response side, driven by innovative companies, startups, and scale-ups, I think we are now consolidating ways of doing things and solutions on the learnings of those early days. So I feel it's a moment where we kind of come a lot more prepared to what's next. At the same time, we are starting to really analyze the data that we accumulated so far to understand how we can improve. And I feel this will be a constant iteration as we will go through the next months.
So maybe this time not 10 days to go 10 years, but maybe a little bit longer. Maybe you have 2 weeks this time. So I want to test some things with you because, one of the things that I've been watching here in, the US, and it's like, I'm trying to talk to my friends around the globe just to keep checked in on whether or not the market is kind of tracking the same all over, or if things are different. So one of the things we've seen here in the US was there was the big uptake of telehealth at the very beginning when we started our lockdown and our quarantines. And then it's like as time went on and things started to open up, we saw the telehealth use dip among patients. Have you seen something similar?
Yeah, we are fortunate enough to work on so many markets, including the US. I think and this is something that we have been analyzing quite a bit. I think it was inevitable that we had, or better than rather than inevitable, has been fortunate that we had this big uptake in the beginning. Mm-hmm. And we were forced to because of the lockdown or even the social distancing, right? So yeah, we had to do that. And we were perfectly expecting a dip afterwards because, of course, that would have been too extreme and not sustainable anyway. But it's same in other things like e-schooling or kind of grocery, e-commerce.
Delivery, yeah.
Delivery. So I think it was expected to decrease and get a new balance.
Okay.
What we are seeing in many markets is that the landing level of adoption, so to speak, I would say after phase one, because it's already changing for this kind of second wave. But if we look at the time in between, which is probably an anticipation of what will be, the future normality, right? The level has decreased, but still the landing level is much higher, incomparable to what it was before. So, and we see this in all markets with just differences, but really it's a global trend.
No, so I think here the toothpaste is out of the tube is the analogy. I don't know what the Italian equivalent would be of that, but it's just, the genie is out of the bottle, the toothpaste is out of the tube. It's too far to go back. Do you agree with that?
Yeah, absolutely. And also, those kind of innovations are also driven by people needs, right? So the moment that you learn that you don't need necessarily to travel hours, or in some countries even an entire day to get a 20 or 30 minutes consultation that you can do from home or even from the place of work, it's hard to tell people, wait a minute, now that you can travel, your visit starts to be inconvenient again. So we close the digital, the telehealth, and you again need to travel, you need to take a day off at work, you need to have maybe somebody that kind of travels with you. I think this is just over. And there will be providers that will be able to keep providing this, and others that will try to go back to the old model. I think customers of healthcare will just choose those that will live in the future and will not try to bring, kind of patients back in the past. So I think this is really what we are already observing. Mm-hmm. If you look at China, that likely is ahead of the game. If you look at that, the landing point is a much higher level of digital engagement between providers and patients, to name one of the multiple kind of interactions out there, that is a lot more digital than before. It's not only digital, and as it should be, but It's much more digital than before. And we see this almost in every other country that we are working in.
I'm curious too about beyond just telehealth, some of the other digital health applications or things like remote monitoring solutions, or, I feel like For me, Europe always had a little bit of an edge on the digital therapeutics category. I think because of the relationship with so many big pharmaceutical companies being headquartered there. What are you seeing in those categories that are kind of, supportive to telehealth? And so it's like, to me, it's like telehealth is kind of the first step of really digitizing healthcare. And then it's like, there's all these other things then that can be layered on it. What are you seeing as far as some of the uptake around those different types of categories of solutions?
I've been talking quite a bit about the tele-everything,
Yeah.
as others also have done. I think what's really happening is that I really consider telehealth very broadly. Is a terminology that for the even
Started.
yeah, it's like very understandable by everyone, right? So we know, talking in a more kind of precise way, that is probably the most logical step one, because you can reconnect the doctors and patients, right? And you can do this in video for a video-based consultation. You can have document sharing. You can have a sensor connected. So you start to really have a real like medical act through, the remote connection. That I think it's like the, like the beginning, because with under that analogy, we have seen much more faster adoption of digital therapeutics, but also all sort of different connected health kind of solutions. So I think there's almost like a telehealth is kind of paving the way, and by analogy, a lot of other things, kind of digital nutrition carried out remotely. So there are a number of different categories that are kind of getting improved access and willing to try because of the obvious, video connection to make up for the loss of, access to doctors that are kind of following that the trend and thriving. This also from a policy perspective, we have seen, we've been working with companies that had solutions, and then they've been in talks for ages with payers to get those things, come to fruition. And at some point, they got a lot more access, a lot more, just like headspace and attention by providers. And so in shorter time, in much shorter time, they've been able to really have those solutions hit to the market integrated with those providers. So generally speaking, there's a massive acceleration all the way through.
All right, I want to ask one last thing before we get to talking about frontiers, and it's, for me, actually, it's very related to frontiers. So one of my favorite reasons for going to frontiers every year in Berlin in November was to, get a sense of what was happening in the investment ecosystem in Europe, talk to some of the investors over there, some of the, the venture capitalists and some of the strategic investment arms of those big life sciences or pharmaceutical companies that have their headquarters over in Europe. So what have you been, have things changed in terms of what investors are looking at as a result of the pandemic? Have you seen anything that indicates, what they might be more interested in now and how that's different from what they were looking at before?
I think in terms of what they're looking for, and what we are looking for as well with our kind of investment part, it's comparable to what it was before. Clearly, telehealth got a whole new life, in a way, because of especially the way it's perceived in the market, and also by providers, institutions as well, which play a big role everywhere, but in Europe in particular. So I think, we all know the data that by the end of Q3, more money that the entire last year had been invested. There were some hesitation in the beginning. I remember whether investment would have kept going, or kind of paused or slow down or dry up even, and I was convinced that investments would have accelerated, and we probably even talked about back then, which indeed they materialized in that way. And again, at no surprise to me, because clearly is now, I think, understood that digital health innovation is probably one of the key things. It's surely one of the key things that will keep healthcare sustainable and efficient moving forward. And we all learn, I mean, as a global community, that without a solid healthcare foundation, there's no economy, there's no society that can thrive. We all kind of knew, but once we have been confronted with the pandemic, it kind of materialized to every one of us, even if we are not working in healthcare. So I think on that side, it didn't change much. There is just a relative more close attention to all sort of remote monitoring and telehealth in the broader sense than right before. What I think has been interesting is this kind of acceleration of the pace of investments. I think there's still a gap, honestly, between Europe and the US and other regions in terms of especially certain phases. It's probably relatively easy to get seed money, but to really have enough energy to scale, still, I think, for European companies, in the context of European investors, is still relatively more difficult than in other parts of the world. So I think there's a general acceleration. Things are getting better, but probably there's some work to do to have scale up money with a focus on Europe.
Okay. And what's the reason for that? Is it because all the different countries have different healthcare systems and different healthcare markets and things like that? It's just so fragmented?
I think it's a little bit of a couple of things in my experience. One is that it's a little bit tougher. You have different systems. In some countries, you have subsystems by regions, which makes it very tough, especially to scale, because you need to do a lot of adaptation. With that said, those are incredibly interesting markets. Look at Germany with the new law for digital therapeutics.
Yeah.
Makes for a very sizable market with 70 million people that all of a sudden are accessible for digital therapeutic solutions. So with that said, still you have all these differences. So it's not really one market, of the size of Europe. On the other side, there's also probably still a little bit of a different, I would say, risk appetite in the different funds on the two sides of the pond. Mm-hmm. Besides those that are kind of global in nature, those that are more kind of regional, still look at things in a slightly different way. Now, I don't know if that is the chicken or the egg, really, whether it's the market, this relatively more challenging environment to scale, or is kind of the other way around. I see signs of, movement on that front as well, and we will see and hear at Frontiers about different companies that are overcoming those barriers. But I still see, relatively speaking, more US headquarter companies approaching Germany rather than European companies, finding their way, of course, with all the due exceptions, but finding their way to kind of scale up within the continent. So I think for the innovation ecosystem of Europe, there's still some work to do to put, all the ducks in a row and make sure that, those innovative companies have, the kind of clean enough runway ahead of them to really scale at the pace that we need them to scale. But I see this positively because every year is better. It's just that I believe we need to really accelerate because the need is greater than before.
All right, so let's talk about Frontiers, because I'm so disappointed that it cannot be in person in Berlin. This is one of my favorites. Like I said, I like to get my little finger on the pulse and talk to people during the espresso break in the afternoon about what's going on. But one of the things that is good about the fact that it is virtual is that I feel like a lot more people are going to be able to be exposed to what's going on, not only just in Europe, but around the world. And you guys have curated a really interesting program. I think you told me more than 60 different sessions, which is like a monster of a conference. And I'm excited about this because I feel like I've talked so much about it. I've interviewed people, I've brought content back, and now this is a chance for a worldwide audience to really have an opportunity to see what this is all about. So Roberto, tell us what you're most excited about when it comes to Frontiers this year, how the program is shaping up, some of the things that people who have maybe always wanted to go but never had a chance to physically go to Berlin, now they can virtually go to Berlin and Italy and all the other little stations that you guys have set up. I mean, give us a sense of what's going to happen this year at Frontiers.
Yeah. First off, we had to move the conference virtual, but we tried in the spirit of the new normal to, while in May was fully virtual, this time we have an hybrid, as we define, conference, because we have both of the virtual and we will have these local hubs that have been animated by the Frontiers community in different places. So we are having a hub in Helsinki, in Finland, for example. We have Berlin as an hub. We have Barcelona. We have Lausanne, Switzerland. We have Malta. Of course, we have Italy. We have a Singapore hub. So there are a number.
Like the tour I want to go on as soon as I'm set free from this quarantine.
Exactly. So there's this hubs that, according to the provisions that have been also changing over the last weeks. So some have been confirmed, some other have been virtualized, but we have these hubs, and then we have other sessions which are purely virtual. Now, every content, whether it's originated by virtual, so in the cloud, or by a physical hub, everything is streamed globally through 2 segments of plenary sessions over the 2 days, and a number you mentioned of parallel sessions that people will choose from. While in Berlin, this was limited to 600 people by design traditionally, and up to 4 or 5 parallel sessions. This time, of course, we can open up to more people, so we expect probably more than double. And I can tell you that we are trending that direction. And also there are more parallel sessions. So as an example, the very traditional startup discovery session that over the time now hosts not only startups but also scale-ups. Typically, they were 2 sessions for earlier stage and later stage companies. This time have become 10 sessions by topic. So this time companies have been grouped by topics, and you will be able to choose the room where you want to hear from live, and then they will be on demand. So we will have digital therapeutics and biomarkers. We'll have disease knowledge diagnostic and detection, remote monitoring, virtual trials, virtual reality, tele-everything, to name a few. And you will have companies that have been either selected or invited to present in the usual startup discovery format, so with investors that will question them, and also audience will be able to ask questions. So there will be, those sessions, and then there will be a number of sessions around learning and content. So we have multiple master classes, and I'll name a couple to give a sense of that. There's one quite interesting, how you can make, as a startup, an offer to payers they can't refuse. So we will hear from a medical director from a payer that will basically interact with founders to teach them how to build the proposition that they can buy into, which I think is quite interesting. Of course, we have a focus on digital therapeutics in so many different ways. There is a plenary panel about strategies and policies for access, and we will confront Germany, US, UK, and other markets, how they're doing, and in order to maximize access and create conditions for reimbursement. We will learn more about, of course, the German case 1 year after the introduction, which was unveiled at Frontiers.
Yeah.
So we'll learn about the first companies that made it through and now are reimbursed. What are the learnings of the first year? We will have the General Director of the Federal Ministry of Health, which is also the President of the European Council for Healthcare in this semester, that will give one of the opening keynote talking about this German vision about healthcare innovation through digital, which I think will be very interesting for the various institutions that will be attending the conference. And then, of course, we have a lineup of amazing CEOs that some of them have even participated into when they were early stage in Frontiers years ago, now are kind of very large companies. We will have Click Therapeutics, OneDrop, Teladoc, Bioformis, Propeller. So, you know, as always at Frontiers, CEOs that really scaled up are coming back to tell the story, explain the journey, what's next for them, but also to be role models for the youngers, right? The younger companies that are there for the first time. So the spirit of Frontiers is intact. We will miss the hugs, the laughs, the food, you know, the experience, but we will have our opening show anyway in virtual. We'll have music. There are a lot of surprises.
We look forward to it. So tell everybody again, when is it so that they can register? I know that it's frontiers.health is the website, but what are the dates for the conference again, Roberto?
Dates are Thursday, 12th of November and Friday, 13th. We will be starting at 2 p.m. Central Europe time, and we will go through 8 p.m. for both days.
Okay, so for those who are in the US, it's like the morning.
It's the morning.
It's the morning.
But it's still civilized. It's not
civilized time, but you can enjoy your coffee while everybody there is.
Exactly. And for our friends in Asia, is civilized as well on the end side of the day. And the other thing that probably is worth mentioning is that, you know, networking and those, you know, after conference talks have been always very important, and you know, for the attendees. They will be, you know, done as well this year, but virtually. So there will be rooms by themes at the end of both days, where people will be able to enter and, you know, congregate with the others that are interested in the same topic. Those will be all open, so you will be able to hop between one and the other. It's an experiment. We'll see how that will go.
You know me, I definitely like to hop around at those.
Yeah. And there will be also the community side of the platform for the one-on-ones and booking meetings and all of that. So we hope that the virtual, you know, makeup for this will be, you know, as fruitful as possible as, you know, has been for the past years in presence.
All right, Roberto. Well, last thing for you before we wrap up, I just want to give you an opportunity to promote the other website that you're working on, which is newnormal.health. Really quickly, tell everybody what that's all about before we close this out.
Yeah, as Healthware, since the beginning of this emergency, we have created and keep nurturing this strategic response model that now I'm really proud that many companies are adopting in different parts, whether it's about virtual meetings, whether it's about healthcare professional engagement or digital strategies and so on and so forth. So we decided to create this new normal.health to publish studies, point of views, reports that we have been generating over this time, and we keep generating in order to offer one more, because others are doing other things like this, one more educational resource out there for all of us to learn about what's possible as we transition towards this new normality.
I love it. The digital guide for digital health. Digitization. I love it. Beautiful. Roberto, thank you so much. Again, you guys definitely go and check out frontiers.health. Register for that conference. It promises to be amazing. 61 sessions at the same time. That's crazy. In multiple locations in different countries around the world, not even just Europe, but Singapore as well. That's pretty impressive. Roberto, I look forward to it as always. Can't wait to see you in person one day soon. And we appreciate also your input on what's going on in Europe. So thank you so much for giving us such deep analysis of, you know, both the entrepreneurial community there and then also the investment community that's supporting them. It's really important for us to hear that over here in the US as well. So thank you for your time.
Absolutely, Jessica. Thank you so much, and see you at Frontiers.
Yes, you will. And in the meantime, guys, if you want to check out more interviews with thought leaders who are changing the way we do healthcare around the world, please go to my YouTube channel. It is youtube.com/WTF Health. I'm Jessica DaMassa. Thank you so much for joining us. We'll talk to you soon. Take care.